Well, firstly, Happy New Year to everyone. I hope you've had a wonderful start to 2022, and thank you all for joining this important Future Leaders webinar. Today, we'll be talking about ways you can take a preventative focused approach to improving mental health in your workplace, as well as exploring ways you may be able to measure how effective a mental health program might be. My name's Kessie. I'm one of the Future Leaders Steering Group members, and I've been working in health and safety for 5 years now. I'm joined by Future Leader Ellis Fenwick.
Hi, Kessie.
Hi.
So I'm Ellis Fenwick. I'm part of the IOSH Future Leaders Steering Group, and I currently work for an organisation called the Illuminate Education Group based in Yorkshire.
Thank you. I'm also joined by Peter Jenkins, another Future Leader.
Hello, good afternoon, everyone. Happy New Year. Yes, my name is Peter Jenkins, and I'm also a member of the Future Leaders Steering Committee. I'm currently a group health and safety manager at a company called DL. We specialise in food manufacturing, packaging manufacturing and distribution across 19 sites in the UK.
Thank you. We also have some incredible panellists with us here today. Dr. Karen Michell, who is the research program lead for IOSH.
Hello, afternoon to everybody, and again, Happy New Year. Yes, I'm the research program lead for occupational health at IOSH and have been an occupational health practitioner for more than 25 years already. Thank you, Kessie.
Thank you. And we also have Mamo, who is the head of workplace wellbeing for Mind.
Hi everyone, Happy New Year to everyone. Yes, so I'm head of workplace wellbeing at Mind, the national mental health charity. So I oversee all of our programs that relate to mental health in the workplace, and I've focused on workplace mental health for around 10 years, but it's been really interesting the last couple of years to see that accelerate. So very happy to be here today.
Thank you. Before we get started, just to say, please put any questions you have in the chat. I'm now going to hand over to Ellis, who will start with our first round of questions.
Thanks very much, Kessie. Welcome, Emma, Karen. Great to have you both with us today. So firstly, I'd like to ask Emma, why is mental health so important at the moment? Do you believe the impact of the pandemic has brought about any potential opportunities in terms of mental health initiatives, things along those lines?
Thanks. Going into, thinking back nearly 2 years now, going into the start of the pandemic at Mind, obviously we were thinking about the mental health impact of a pandemic such as this, because you can see it cuts across all areas of our well-being and our health, physical health, our social well-being, financial, as well as our mental health. And I think it was reflecting that for all individuals, it's not going to be a static thing. It's been a real roller coaster just for myself in terms of the impact it's had at different times and for different reasons. And then if you think about just the impact of a pandemic such as this on mental health, it is about the anxiety that goes with that. Will I get it? Will family members? The huge loss of life and bereavement and grief that many people have experienced. And just the fact of, the restrictions and the lockdowns that we've all faced and how that's affected the way we would normally manage our mental health, the access we'd have to things that keep us well. So you can kind of going into it, we would anticipate that it would have a huge impact on people's mental health, but we always want to be informed. So we've been running surveys during this time. And what we found is 29% of adults have reported that their mental health has got worse since March 2020. The Centre for Mental Health, another brilliant mental health charity, has been doing a lot of research too. And they found that 1 in 4 people experience mental distress for the first time in their lives because of the pandemic. And 1 in 6 then went on to access mental health support for that mental health issue. So we've kind of seen a real increase in the severity and scale of mental health problems across the UK. If you then want to look at work, and obviously COVID has had an impact on how many of us work in our day-to-day lives, or it's increased and intensified work for us. But business in the community have found that 41% of employees have said they have experienced mental health problems that have either been caused or worsened by work. And equally, the labour force survey has found that I think they found that self-reported illnesses around caused or worsened by work has grown by 19% overall. But when you look at the illnesses caused by mental health reasons, so stress, anxiety, depression, that's grown by 35%. So this idea that work and changes at work are driving poor mental health is obviously a concern. And then with all of us logging on to Zoom and potentially working from home, that's another huge change that's come about that is having positive impact, but also negative. So, you know, people wanting to continue to work from home for part or all of the time, or indeed organizations wanting their people to work in that way, and what that means in terms of work-life balance. So I think, you know, we've all been in the same storm, but a different boat, and it's understanding that. But in terms of trying to see some positives, I do feel that it has highlighted that we can work in different ways. We can offer people flexibility, one to support their mental health, one if they're a working parent, and so on. So for me, I think it has kind of increased mental health literacy, and there's more conversations happening about mental health. There's more discussions about how work is organised and managed and how that impacts on people's mental health, and vice versa, really. So for me, I just see this as a great opportunity for a bit of a reset. How can we build back better in terms of work? And design work with mental health at its heart, rather than as an add-on, which is what it's been in the last couple of years as awareness has grown. So I'll stop there because I could go on forever. But yeah, I do think there's a great opportunity here that we should all grasp with both hands, really.
Yeah, absolutely. Completely agree with that. And I know I've seen it in a few businesses, sort of people looking to move away from just in office working and moving sort of more agile and looking at sort of that work-life balance. Karen, anything additional from you on that one?
You know, I think one of the things that is really important to remember is that we actually came into the pandemic in a distress situation already. So mental health has been recognized as a problem for a long time already. And I think what is really significant for me as an occupational health professional is the fact that the recent report by WHO and ILO has actually recognized long working hours, and that's a working week of longer than 55 hours, as a recognized occupational hazard, and it causes more occupational death than many of the traditional occupational hazards. So there's definitely a renewed focus on mental health related issues. And I also think in terms of the occupational environment, the pandemic has actually helped to destigmatize mental health issues. Traditionally, people have been reticent to come forward and speak about their concerns. There's always been this reticent to kind of, you know, criticize the working environment and your working conditions. And I think that is something that we need to, as Emma says, build on in the future. The fact that these conversations are now being held more openly with, you know, workers are feeling a lot more comfortable doing so. So that is something that we must definitely latch onto and encourage it to continue into the future. I mean, one of my concerns is long COVID. 18 months ago, long COVID was getting so much focus, and as I feared then, already we are starting to forget how many people are still suffering with long COVID. So, you know, those are things that we mustn't let happen. We need to grasp these opportunities and roll with them, as they say.
Yeah, absolutely. Thanks for that, Karen. And I suppose sort of the point that you were making about, you know, increasing conversations and things like that, it leads sort of nicely onto my next question, which is sort of in terms of in-house support, what do you think you can expect to see over the next 5 years? And how will this differ between large organisations and SMEs? So that's small to medium enterprises. So Karen, I'm going to throw that one at you initially.
Yeah, I want to start off by saying my fear is what we call the knee-jerk response, that organizations will think that the solution going forward will be to just train more mental health first aiders. It's part of the solution, but it's not the solution. I think what organizations will have to start to do is recognize that mental health issues are not those personalized problems that historically I mean, when I started working back in the 1980s, workers were clearly told, leave your problems at the gate. You don't bring to work your personal issues, you know, and I think that's what organizations need to understand, that mental health issues are very much, not as much, but very much a consequence of the working environments that we put people into. So organizations are going to have to start measuring psychosocial hazards. I mean, if you ask the majority of IOSH professionals, for example, how do you measure these psychosocial stresses, they probably don't have a solution for you. How do you measure burnout in your workers? How do you measure the mental health status of your workers? And I think these are things that organizations are going to have to start doing moving forward. Another thing that I think organizations that want to be sustainable are going to have to understand is that you can't separate mental and physical health, that mental health causes physical ill health and vice versa, and that the companies that think that they can get away with not addressing hypertension, diabetes, musculoskeletal disorders, etc., in their working populations will be the organizations making mistakes. We need to grasp the opportunities to actually help workers to improve overall health, because we obviously then are going to see the benefits from both a physical and a mental health issue. I think that is going to lead to a lot more lifestyle management programs. But again, this is where I get very cautious, because the answer is not to just run out and engage with the first wellness service provider that you find. That organizations are going to have to start looking at the service providers that they engage with and ensure that the services that they engage are going to do what they need them to do. And I'm going to give you a really good example here. Years ago, I was working in a pharmaceutical company, and we had a female worker, 29 years old, who weighed 289 pounds. And she could not do her job. And long story short, we had all kinds of ergonomic assessments done, and the end result was there was nothing wrong with her health-wise. Her problem was she physically couldn't reach her workstation. The company's wellness program was then contacted, and we were asked, please, can you help this woman? We've got a lot of work. And all that service provider was prepared to offer was 1 day counseling. That is not going to help resolve those issues. And that's what organizations need to be aware of. Yes, they will want to engage with service providers, but make sure that they are using good, sound programs. I think one of the real issues is going to be large versus SMEs. Your large organizations have the resources to engage with service providers, and invariably would engage with an in-house provider. SMEs generally don't have that luxury and are going to be very reliant on external service providers and interventions to help resolve their problems. I'm currently a consultant on a Mentup project that is looking at exactly that, intervention specifically for SMEs, because much of the literature that has been researched at the moment doesn't show that services are being assessed as validating, that they are actually impacting mental health positively. So for me, those are going to be the challenges moving forward.
Mm-hmm. Thanks, Karen. And I suppose, Emma, from an SME perspective then, what in-house support can we expect to see over the next 5 years? I know Karen touched on a couple there.
Yeah, no, I'm happy to cover that. I just wanted to circle back to some of the points that Karen made, and just reflecting myself, work, what we consider to be work, is becoming increasingly complex over recent years. Workplaces where you do your work has been becoming more complex, and it's been accelerated by COVID, the fact that many people are working from home and so on. So, and there's always that paradox that, yes, working from home gives you more control, but it also means work bleeds into your home life. So where is the control and so on? So for me, there's just that general trend, which has been accelerated by COVID. And then there's the idea that people are complex and people's mental health is complex, and how they manage it, and what makes one person well might actually make someone else unwell in terms of how work is. I thrive under pressure and I love deadlines and blah, blah, blah. But, everybody's different, and you can also experience it differently based on what's going on at home. A lot of things are caused by work. Sometimes it's a combination. And I think what has been good about the pandemic is it's also highlighted that work and mental health, that relationship is complex. And there's much more recognition that a lot of jobs have emotional labor attached to them that wasn't really talked about before, like moral injury and things. So I feel like there's a real mood to just really understand that this is not an easy thing. It doesn't get solved overnight. Indeed, I don't think it does get solved. It just evolves. And there's an idea that we need to take a much more people-centered approach, and we need tailored solutions. So I just wanted to kind of build on what Karen was saying there about, what's needed. And a few years ago, saying to an employer that it needs to be top down, bottom up, and side to side in terms of your provision was a really tough sell. But I'm hoping that the pandemic will kind of make people aware of the need for this. So for me, I think some of the trends are that people-centered approach, that flexibility, a holistic approach to well-being. As Karen said, it's physical health, it's mental health, it's financial health. So again, thinking about your provision, which touches all those different pillars that underpin someone's well-being. And this idea about intersectionality, and this idea that people are not one thing, and this idea about equality issues and people's mental health and so on, and just really needing to understand that and be responsive to that is important. And also family-friendly workplaces. I think we've shown during the pandemic that working parents have really suffered, and indeed within that working mums have really had to kind of shoulder that burden. So those are just some general trends I wanted to share. I think for small to medium, it is that issue about how do they access occupational health and that kind of specialist support. And obviously the government's consultation, health is everyone's business, and their response is going to be trying to improve how smaller organisations can access that kind of support when they need it to advise on reasonable adjustments, workplace support, etc. But one thing we've seen through the work that we do around the mental health at work commitment, so that's a pledge that an organisation can sign up to. And when people have been saying what they've been doing in response to the pandemic, more smaller organisations are changing their organisational policies or processes if they have them in place, or indeed just their ways of working. And there is a view that potentially smaller organisations can be a bit more nimble, a bit more agile, and a bit more responsive to this idea of offering flexibility to staff and not being so wedded to you do your work between 9 and 5 and you do it here. So I think that's something we might see that's a positive in a smaller organisation, rather than a larger, more bureaucratic organisation per se, although they might have access to that kind of specialist support. So those are just some further reflections I had for smaller organisations.
Thanks, Emma. So I suppose in summary then, from what yourself and Karen have sort of said, it's sort of playing to the organisation's strengths, if you like. So larger organisations, like you mentioned, Karen, they've got a lot of ability to pull in resource, whereas smaller organisations, like you mentioned, Emma, they can be more nimble and more flexible in sort of the support that they offer. So
more person-centred, maybe, those individual relationships, that really knowing someone as a person, potentially.
Mm-hmm. Absolutely. So the last question from me then, are there any shared learnings which we can apply to companies working internationally? So Karen, I'm going to kick off with you if I can.
I think one of our strongest learnings is that prevention is better than cure, and that there is a need from an occupational health perspective to better manage organizational culture. And we're not just talking about the psychosocial hazards. So I first want to go back and I want to look at your traditional occupational hazards. I mean, those that most of your IOSH professionals are familiar with: chemicals, biological, physical hazards, etc. These need to be managed so that we are confident that we are providing workers with safe and healthy working environments. That is key as a starting point, that we get that right. The focus then coming through to the psychosocial, and I think that has been a big international learning of late, especially with ISO publishing the latest 45003 standard, which is specifically gearing itself to managing psychosocial hazards in the workplace. And I mean, organizations need to understand that there are many issues in the workplace that, for example, the worker may not have control over at this point. Staffing levels, the work demands that are being placed on them to get activities completed, time pressures, managers that they have to work with. I mean, poor management style is a very profound psychosocial hazard that workers are trying to cope with. And I think what we have to remember is that organizations that are getting it right, that are actually putting preventative strategies in place, simple things. I worked for a pharmaceutical company that made an across-the-board decision that every single department was given what it was called the chill-out room. And it was a space in which workers could go. There were no desks in there. In fact, there were bean bags and the likes. There were coffee, fruit stations. But it was a place where workers could go at any point of the day, not just at a recognized tea time, and kind of chill out. And that seems to be something that is really impacting, this kind of preventative culture, that from a psychosocial point of view, you can kind of address these issues before they develop. Because, once we have to deal with mental health issues, it's a completely different approach altogether. So for me, the key is prevention of mental health issues from the outset. Again, globally, you've got to remember that there are cultural differences to the way mental health is perceived. So you will have each country and for even regional differences that I come from Africa, spent a great deal of time working in South Africa, and just working from one province to another, your approaches had to be tailored and individualized to people and organizations. And I think companies that have successfully done that are going to be the companies that are going to have sustainability going forward.
Yeah, absolutely. Thanks, Karen. And I suppose monitoring anything that you put in place as well to make sure that it is effective, because like you say, you can implement something from the top down, but if it doesn't work for that region or that business, then it's essentially useless, isn't it? So, Emma, anything to add on that?
It's just to say, the UK is probably, there's been a focus on mental health in the workplace for a number of years. And then there's that question, how can we export what you're doing in the UK to another country, to another, geographic location? And I think it's to echo what Karen says, you can't just export something. It needs to be translated and contextualized, and absolutely cultural differences around mental health language and stigma is really important. And then it's indeed the legal framework that exists around working practices, even for companies in the UK that have a sister company in the US, because there's very different holiday allowance. So talking about work-life balance is not the same in the UK compared to what people have available to them in the US. So, there's definitely stuff around the legal framework, working practices. And then there's also just about health provision, what can people access to support their mental health in different countries. We have shocking waiting times in the UK, but other countries have even worse provision. So you kind of really need to understand the local context in order to develop something in your workplace. But there has been something developed, I think it's the Global Business Collective, that's come up with a CEO and a leaders pledge, and I'm happy to share a link. So I think it's the Global Business collaboration for better mental health. So if you are an international company, you have offices in different countries and you want to engage with that, there is an organization that is supporting international companies. So happy to share that.
Great, thanks for that, Emma. Okay, so I'd just like to cross over with Peter now and see what questions have been coming up on the Q&A. So Peter, has any sort of pertinent questions caught your eye in relation to what we've just been discussing?
Yeah, there's been some great questions that have come through so far, some really, really good questions. I'm going to start just in a bit of chronological order, if that's okay. So we'll start from Flo, and she's asked, what are examples of programs of employers to maintain work-life balance as more workers are doing work from home? So perhaps if there's any examples that you can think of maybe just initiatives that you might have seen for employees working from home to engage with them.
I mean, I can kind of say just from an example of mine, we do keep timesheets because we do flexible hours. We've done that for many, many years, but it was very binary. I started here, I finished for lunch here, I then finished work, and people have been working more flexibly, especially in winter, taking extended lunches or taking breaks throughout the day to get a bit of sunshine. So we had to actually just repurpose some of the tools that we had for capturing hours to kind of be responsive to people working much more flexibly and having a bit more of a, not a piecemeal day, but I can't think of a better word at this point. So yeah, I think there's something about that. And then I think if people are working from home, and that idea of having that separation from work and your home life, we've been trying to encourage people to have end of day routines. So how can you have a bit of a ceremony to saying the working day is done, and how do I switch my focus to the evening or, you know, my downtime and so on. And it actually was adapted from some work we did with health professionals about how you can prepare yourself for a shift and then switch off from a shift and leave work at work. So work might be a physical workplace, or it's just in your living room or a room at home. So again, can share some information on that, but it's just how you can. So for me, I'll always shut my laptop down, go for a walk if the weather permits, and then that kind of means that the working day is done. And even if I remember things about work, I'll write it down rather than feel compelled to, you know, reopen my laptop and start doing a bit of work. So it's just trying to have some more physical boundaries between work if it's at home. But I don't know if anyone else has got anything to add.
You know, I think one of the big things is that there need to be good policies in place, and they need to be clear, because organizations, there's a terrible tendency to keep sending emails and WhatsApp messages and whatever the form of communication we're using out of business hours. And I think it needs to be very clear, for example, that managers may not send, you know, work off to employees after hours. I want to support what Emma says. One of the biggest things is kind of that ability to work flexibly. I know that a lot of that is based on trust, and years ago, well, 2 years ago, employers would have said to you, not possible. They didn't trust that when the workers weren't under their eye, that they were actually working. Well, you know what? A worker can be sitting in the office. It doesn't necessarily mean they're working. They could very well be on Facebook or any other kind of medium. So I think a lot is about that trust relationship between the employer and the employee as well. I mean, I consider myself very privileged. I work for IOSH, and we don't even have to keep timesheets. You know, there's this trust in place that you'll put in your 8-hour working day. If I want to take 2 hours to go and take a walk in winter so I can get some sunshine, as Emma was saying, I can do that. You know, if I want to start at 7 in the morning and finish earlier, and it's done in consultation with your manager. So just that your manager is aware that that's my break period, for example. But what that has also done, it's allowed people to structure their life around, you know, what needs to be done in terms of work, but that they can put their life first. I mean, for years, I was a working mother, and I mean, I could not get to pick up my children from school. So you then have to put support systems in place. And it does, that works on your mental health. You know, you're worried, you know, phone, why have the kids not phoned at their home yet, kind of thing. And I think so many of these initiatives are going to go a long way to improving that work-life balance, but policy has got to be written that clarifies those boundaries. And the reality is, where we don't learn to do it, I fear that regulation is going to be written for us. I mean, already France has legislation in place that says that, you know, communication can't be sent after a certain time of the day. So if we don't learn from that, I think it's going to just create more regulation, which, you know what, we're already very well regulated. I mean, we don't really want people to start regulating those kind of relationships as well.
Yeah, no, it's an interesting point, and there has been discussion at Mind whether we still want to keep using that. How can we have more of a trust-based? It was a positive thing, so people could take the time back. But we've been looking at how we kind of work, and the CBI have spoken as well about what are the minimum things you need to have in place like quality controls, compliance. And then after that, how much can you devolve down to departments and teams so they can organize themselves and get the work done, but in the way that works for them at an individual and team level? And I guess when you start thinking about that, the mind does boggle. So I think whatever policies you create, starting off with a principles-based approach to allow then for flexibility at that individual level, but just kind of talking at a high level about a principle-based approach to this piece of work, because you can't legislate and mandate for every eventual kind of alteration or adjustment that someone might have in place. So I think trying to think in those broader terms is better and more helpful.
Brilliant. Thank you so much for that.
Peter, can I just mention something here? I think one of the things that we need to be conscious as well is there are certain jobs, categories, occupations where flexible working is actually going to be a significant challenge. I mean, you think about people working on production lines, you think about your healthcare workers, for example, and for those workers, they may not have the flexibility, but I think one of the things that managers need to be cognizant of is if a worker, for example, requests to do a shift swap or be offered a certain time, that, you know, the traditional approach of can't be accommodated needs to be addressed, because I think by addressing those kind of requests, managers make the working situation better. So I think we must remember flexibility is not going to be there for everybody. There would still be ways of making that working situation better.
Yeah.
Perfect. Brilliant. Thank you for that. So just to perhaps summarize what's been discussed there, the key things that I've written down were around those who are working from home. Clearly set the expectations very early on between the employee and the manager. Make sure that trust is there between your employees and your management as well, so that they can come to you with their concerns, their questions, and anything around what flexibility means. But what we can confirm is that flexibility doesn't mean that you're available all the time, every time.
Yeah.
The communication structure that you have between your management and your employees, same again, very important, from the informal communication that's there and the formal one. If your hours are until 5 o'clock, but you work from home, do you still answer emails at 6, 7 o'clock, 8 o'clock at night? Is that really beneficial from a mental health point of view? And then finally, how can we make sure that our performance management is not going to penalise or be perhaps unequal for those who work from home versus those who are in the office that might have a little bit more oversight in terms of what they do? So some really, really fascinating insights and points on there. So thank you so much for that, Emma and Karen. I'm very conscious of time, and I know that we've got 3 more questions to get through. There are a couple more questions that have come through in the Q&A, but what I want to do is offer the opportunity to complete the other questions that we previously set out, and then come back to these questions, because there's some really meaty, good questions that have come through, and we'll try and get through as many as we can once we've gone through these next 3 questions. Is that all right? Brilliant stuff. Perfect. So back over to you, Alex Kessie. Thank you.
Thank you, Peter. The next question is for Emma. How can we ensure the mental health of those performing a supporting role within an organisation, such as a mental health first aider, is protected?
Sure. I think for mental health first aiders, or in other organisations, they're called mental health champions, but they're meant to be acting as a listening ear, somewhere that people can speak to someone outside of the line management structure, and then can be supported to access support that's either provided in the organisation or signposted out. And I think people often volunteer for that role because they understand that mental health is so important and they want to be part of the solution, but that may be because they've been personally affected. So I feel that, you know, what's really important to support the mental health of people performing that role is giving them a very clear role description. What's the remit of their role? What are the boundaries of it? And then just making it clear that how it might relate to other kind of support mechanisms in the workplace. So how is it different if they have got first aiders versus a support group, etc., etc. I think the next bit is just making sure people have the resources to do the job. So this is obviously a voluntary role on top of their job, but kind of making them do it by the side of their desk and not giving them adequate time or training or resources to do the job well, and so on will be problematic. And then I think there needs to be some kind of supervision that happens along the way routinely, as well as the opportunity to have a debrief after a challenging interaction, or if they're not sure if they've advised someone in the right way. And I think it's also understanding what might be personal triggers. A lot of people may have lost someone to suicide, so talking to a colleague about suicide would then be triggering for them. So I think there just needs to be those support structures so they can talk about something that's connected with them or stayed with them or they're worried about, and making it clear they can step away from the role at any point if they need to for their own well-being. And then I think it's just about having clear policy and practice in place if there's any safeguarding concerns. So if you're worried about a colleague you've spoken to, how to escalate that, and having that clearly laid out. So those are my main pointers. So it's just about having a really robust framework to support the people to perform that job well, that role well, sorry.
Yeah, I completely agree. Karen, do you have anything to add?
I think Emma has covered it very well, in terms of your mental health champions. One of the things I just don't want us to forget is that managers, line managers and supervisors are also managing mental health issues and the psychosocial stresses. And I think it's important not to forget them and make sure that they are empowered. Unfortunately, we have this thing called the Peter principle, where people get promoted into positions because they were good at the job that they were doing, but the job they're going into requires completely different skills. And here we're talking about people skills. A lot of people don't have good people skills. So we need to empower those managers with the correct training to ensure that they've got the skills to manage people effectively and also to monitor their well-being. Again, I'm going back when I trained. Every Friday we had debriefings, regardless. There was a time set aside and there was debriefing, and that was honestly in many cases what kept your sanity going, because for healthcare workers, for example, I mean, we haven't really spoken much about this, but they have seen a significant amount of moral injury during the pandemic. They've been placed in situations where we have challenged them. They are trying to help patients. They know that they can do more, and they are powerless to do more. And the burnout within the healthcare sector is significant at this stage. I mean, studies are showing more than 50% of healthcare workers could be suffering from burnout. And we need to remember that they need to be debriefed. They need to be given the opportunity to speak out, to express their frustrations, in some cases their anger, because if they don't, it stays on board. And, how does the saying go? Something about suppression, regression, depression, that if you don't talk about these things, they are just going to be exacerbated and become significant concerns down the line. So debriefing and make sure that all managers have the skills necessary to work with people.
Agreed.
Yeah, thank you. And then just to kind of go on from that, what support measures or adjustments can be implemented if someone's experiencing poor mental health?
For me, there's actually a lot that can be done, and often organizations are already doing it, but don't actually realize that these are supports that are actually assisting their workers. And I think one of the most important things is to recognize that there's a problem. I mean, so often we try and sweep it under the carpet. If we ignore it, it'll go away. That's not healthy. We need to have those open conversations with people. I'm going to tell you that personally, I've been diagnosed with burnout twice. And in both cases, it was not me who thought there was a problem. It was people around me that identified a concern. And had it not been for their speaking up, who knows what might have happened. I mean, luckily, I now know how to prevent it from happening again. We then need to try and get to the root cause. What is it that is causing the issue? And again, not to focus on the individual, but to start by looking at the workplace. What is it in the workplace that's possibly causing these problems? And then we need to understand how severe the problem is. And again, this is, you might have somebody who can be managed quite effectively within their working environment. You may very well have somebody who needs to be removed from the working environment, put on a period of absence while they are receiving support. But there are things within the organization, things like deploying people to a job where they are going to be removed from their current work pressures while they are managing or being, you know, we're helping them manage the situation. The fact that you can then allow them the flexibility that they're having a bad day, well, don't come into the office today, you know, stay at home and do as much as you can. You know, we don't have to then sit and clock watch and make sure you get the number of hours. So companies need to be flexible. Have the conversation with the worker. What is it that will work for you? Because what will work for Joe is not going to work for John. So you need to understand what is causing or the underlying causes of their problem. How can you address them effectively for them? So I think that is very important. The other thing is the big issue about long working hours for me, and this is definitely a concern from the work from home. A lot of people will express that they're working much longer hours because they're not commuting, they're starting early, etc. Well, you know, that goes right back to what Emma was saying earlier about, you know, making sure that those structures are in place and that workers understand that this is your period of time for working, and outside of that, walk away from it. So Beth, there are many things, many of them we've already discussed through the webinar, but the important thing is individualize your interventions and make sure that you understand what it is your worker needs. And you know, the reality is they may very well need advanced health services, you know, your occupational health professionals, mental health services, etc. And you would then need to try and refer them into these services. Like Emma was saying, we have long waiting hours, long waiting periods at the moment for access. That's not just a situation unique to the UK. And that is going to be where one of our challenges is, possibly supporting workers while they're waiting for those referral services to kick in as well.
Yeah, definitely. I suppose that kind of leads on to employees' duties under the Equality Act. Maybe, Emma, if you could talk a bit about that.
Sure. So the Equality Act, it defines a disability as a physical or mental impairment that has a substantial long-term adverse effect on someone's ability to manage day-to-day activities. So for an employer, you think, okay, do I need to then make a reasonable adjustment for an employee who does qualify under that definition of disability? But for mental health issues and mental health problems, it can be a period of emotional distress linked to a life event or so on. And so someone would never qualify under that quite strict definition. We've been campaigning to change it for many years, but we still have it. But I think for me, an employer, to try and offer any flexibility to staff who are going through a tough time, you know, you invest in people, you train them up, they have organizational knowledge. Why would you want to lose them out of your workplace if they're struggling, rather than offer them some support during a difficult time? I mean, I lost someone very close to me in a car accident, and when I came back to work, I found taking calls from people really difficult, because often we take calls from people in distress, and I didn't have the emotional capacity to distance myself from that, and I was getting quite upset by them. By those calls. And so for 2 weeks, I didn't take phone calls. I got back to people by email. Someone else fielded calls. Now that would never have got me under the Equality Act a reasonable adjustment, but it's something my employer could offer me. So building on what Karen was saying, I think it's changes, you know, workplace adjustment support measures. It can just be how someone does their job, like their start time, finish time, breaking up their hour lunch into free 20-minute breaks or something. It can be changes to their actual job for a temporary period or more permanent, similar to what Karen said. And is it about extra support? Now, if I'm struggling, I can find it really hard to prioritize and make decisions and craft polite no's to requests. So I take on more work. So I'm probably similar to Karen. So having extra time with my manager to go, don't do that, push that back, say no to that, really helps me. So I think looking at extra support either from your manager or from a workplace buddy or so on. So those are some of the adjustments and support measures we know can help people. But it's very individual.
Can I share one more that works for me? And in fact, some of my team members have commented that how impressed they are. I literally will set up my daily calendar. I color code it, and I literally will set up blocks of time. You know, I'm preparing for this, I'm doing that, I'm doing that. Here's my lunchtime. And they then know what I'm doing, when I'm doing it, and when would it actually be appropriate to encroach on my time, so to speak. I mean, I'm not saying don't send me an email, don't make a phone call, but if you want to sit down and have a really long conversation with me, you'll be able to see in my calendar, you know, that I'm not available at the moment. And I think that's one of the lessons that I learned through my experiences. I need to give my personal time the same respect I give my work time.
Agreed.
Yeah, I completely agree. I think a lot of the time we make, oh, I'm very nervous. We'll move on to the next question. What are some checkpoints or metrics that the occupational health and safety professionals can use on their mental health program journey to prove its success? Emma, if you could share some.
Yeah, I mean, some key metrics I think are around, you know, that HR data that's available to people around absence. But I mean, I think that you have to approach that with caution, because people may have not been comfortable to give mental health as a reason for absence. So when you start doing more work on it and start breaking down that stigma and making it okay to say that you're struggling, you might see sickness absence for mental health reasons go up in the short term. So, you know, absence data does give you some insight, but, you know, treat it with caution. I think looking at employee turnover and exit interviews and understanding why someone chose to leave an organization and whether there are any organizational issues is a really rich source of data to tap into and to then see if things are changing. I think retention and return to work rates with staff experiencing mental health problems, again, gives you really good insight. People will always need to take time off for their mental health as needs be, but how quickly you can support someone to come back. What we can often see is people don't seek support until problems have really spiraled and then may be off for longer. So whether or not you could intervene sooner, give people some flexibility, some support measures might prevent them taking time off altogether. But indeed, if they do need to take time off, you can maybe get them back into the workplace and again, support that return to work more successfully. So looking at some of that, looking at your employee assistance program data, if you have access to one, and then looking at how much it's used. So I think those are some metrics that you can tap into. But for me, the biggest measure of success is employee insight. So surveys of staff, either you run them already and you can just add some questions about mental health to them, you know, employee engagement surveys, what have you, or indeed that you want to run a specialist one on mental health, will give you that rich data about how the organization is performing and supporting their staff. I think also at a team level, doing audits, we do them at Mind, just saying to people, you know, what do you think we're doing well at the moment to support your mental health? What are some challenges? What can we put in place? Again, we'll give you that insight. And if you have got mental health first aiders or mental health champions in place, giving them some simple tools to record, not anything personal, but just, you know, how many people they're seeing and if there are any organizational issues that are being raised as a problem. So I think there's lots of different data points that you can get in, that you can tap into. But for me, it is about routinely asking your staff about how are we supporting you and where could we do better?
Thank you. Karen, do you have anything to add?
I support everything Emma is saying, and I think one of the other important key matrix for us as OSH professionals is measure your psychosocial stresses. Get to understand what they are, how severe they are, and then at the same time you can then, you know, measure your employee mental health and start looking at that data, you know, in correlation, because, you know, looking at the information together tells you so much more about what you're seeing. But I think also what is then important is once you know what your psychosocial hazards are and the severity and the level, etc., you need to plan interventions, and you then need to reassess, and are you making a change? Are you improving those working conditions for workers? Because it is my experience that we will go in and we will measure noise, and we know what noise levels are, and we'll measure it again next year, and it's probably going to be the same, but if we're extremely lucky, it might be a decibel or two lower. But we don't do that for psychosocial hazards. They are also hazards that risk assessments very seldom cover effectively. So these are activities that, as OSH professionals, it's an aspect that you really can take control of. You know, your HR data is normally managed by your HR department, and you know, we get feedback from them. But one other area, and this is looking at your interventions with your service providers, you know, find out from them, what is the severity of the issues that are being brought to them, and are they then measuring the effectiveness of those interventions down the line, and do they see a difference in the workers? So that is very important to measure, however you choose to do so, but the impact that the services are actually having. Because I'm going to reiterate again, because it's almost a word of caution. Don't just go out and engage with the closest and the cheapest service provider. I mean, I did my PhD on quality and governance, and it was frightening, the absolute extremes of service delivery that are being provided. So make sure that you're getting your buck's worth when you engage, by getting them to give you feedback on the impact of the services that they are providing as well.
Thank you, Karen. I'm now going to hand over to Peter again for the second round of Q&A.
Perfect. Thank you ever so much, and some fantastic insights there, Karen, Emma. Thank you so much for that. Now, we've had quite a few questions come through. So what I'm going to ask is, if in the spirit of trying to get through a lot of the questions, if we can just sort of try and keep some soundbite answers attached to it. And if we want to carry on the conversation a little bit afterward, we can jump on the Future Leader LinkedIn group, and we can always have a bit more of an exploration of some of these there. So I've got one that had come through that I'd accidentally answered a little bit earlier, and it does relate just back to what Karen was saying there. Before we go into engaging with our service providers, what, in your experience, is the most effective way that we can engage with our staff to define the problems that they have?
Emma, do you want to take that one?
Yeah, no, happy to. I mean, it depends whether you want to do it at an organizational level, but I think with all of this, it's really devolving it down to a team and departmental level. And I think it's similar to what I was saying we do at Mind, just asking people, what do we do well to support your well-being, and how can we take that to the next level? So doing a bit of appreciative inquiry and a bit of kind of strengths building, and then asking, well, what are the challenges? And then trying to look at it in terms of, well, what's under our control, what's under our influence, and then what is out of our control and influence, but how can we maybe manage our response to that? So you can have quite a good conversation, and from that you come up with a bit of an action plan. And obviously the things that are in your control might be about how the team is run, things that are influenced might be about wider organizational issues, things that might be out of your control might be stuff that comes in from clients or third parties, but you can still manage how you deal with that, or things that might be able to mitigate some of that impact. So it's quite hard to kind of say in general terms, but for me, I think absolutely getting your staff involved in the conversation from the get-go, what's working well, what isn't, and the stuff that isn't, well, what's the solution, or might be some of the mitigating actions. And indeed, some of it might just be rather intrinsic to how you work. So then it's about, well, what's the wellbeing support that could offset that? Is that about buddying people up? So getting people who've quite long in their career to share their insights with someone who's just starting out. So I think it can be quite a kind of, what's the word I want to look for? Your staff have the best idea about how to kind of improve things, I would say. So getting them involved in helping shape those solutions.
Perfect. And I appreciate that there's a couple of, if not necessarily say underrepresented groups, but there will be some employees that traditionally might not be associated with being open and honest and transparent about their mental health. Without wanting to paint everyone with the same brush here, I appreciate there is a bit of a stigma that some men will feel about being honest about their situations, about being honest about their mental health. Would you say that things like anonymous surveys, small group discussions, exploring a one-to-one metric with managers and employees could really help try and build the thematic basis for a lot of what you've been discussing there, Emma.
Yeah, I would agree with that. Trying to give people different feedback mechanisms and different ways to engage will help everybody kind of input in a way that feels most comfortable to them.
Perfect. You know, I think it's important to say at that point that what works, for example, in food manufacturing might not work in construction. But as you said there, Emma, really going out to your employees and trying to get that feedback, trying to understand who they are as people as much as who they are as professionals will go a long way for starting to establish the credibility for these type of conversations in the future. Jumping into another question then, is there anything that we've seen in particular about factors that have come through over the last year that have had a real negative effect on mental health? You know, we've seen some businesses have had downsizing. We see a bit of a fear of not only getting infected, but also of vaccines as well. But is there anything perhaps that has been a little bit under the surface or has bubbled through that you think will be more important this year for us to consider?
I think Emma really did a good job in the beginning of expressing the issues that COVID had brought to the picture. And for me, one of the big things is going to be the fact that we are now sitting with a mental health problem. A lot of work, we had a high rate of mental health in the UK prior to the pandemic. It's been exacerbated. And the fact that we're going to have to be aware of that, and we can't pretend it's not there, that organizations that don't address mental health issues are not going to be sustainable in the long term.
I think it's such a powerful point there. It's very much thinking that the conversations that we have now will have such a knock-on impact over the next couple of years. And that if we consider things like delayed effects type of things, there are people that will be suffering with mental health right now that if we don't address them, hey, they're going to be suffering in 2-3 years time. Hey, they might even be suffering in 2 or 3 months time, depending on the severity of what people have been going through. So at the very least, what you've been discussing about the self-reflection point of view, and really making sure that we can hold a mirror up to ourselves as a business and potentially even as an industry as well, and say, what are we doing for mental health? Are we doing enough? Are we asking the right questions to make the right decisions afterward is going to be key. So,
I mean, I think the only thing I'd add to that is just about fatigue. You know, we're coming up to 2 years of living like this, and what is the long-term solution, and, you know, future variants and boosters and so on. So I think I think we definitely all felt it last year when 2020 turned into 2021, that the pandemic would just disappear. And then we've gone for another year of it. And now it's then thinking about, you know, going on holiday. I haven't been on holiday for a couple of years. So I think it's just kind of saying, what happens now? And it feels like, when is the new now going to come? And it feels like more of the same. So I think fatigue and I think loss of control is something that maybe we were in a holding pattern, but now as we transition out, what's it actually going to look like?
Yeah, I think that's such a powerful point there, Emma, and very much thinking about, so again, just that reflective point of view and perhaps a horizon scanning exercise. For those who are on the call that may think, okay, well, what is going to come up in the next couple of years? We've talked a lot about engaging with your employees, having that level of communication with them, but there's nothing necessarily wrong with having a bit of a risk assessment and literally trying to put out and say, hey, what is the risk going to be? For example, from people that might feel lonely, or people that might not feel engaged with, or people that might find themselves withdrawing into this sort of performance cycle where they don't get the feedback that they need to know that they're successful. So although, for example, there's one question that's kind of come through here to talk about how physical disabilities are a bit easier to see than mental ones, but I think it's probably fair to say, Karen and Emma, that really by having that level of communication very early on, we can identify the symptoms, we can identify the signs and address those in a much stronger way over the
I mean, we've developed a tool called a wellness action plan, but it's based on a health tool, the wellness recovery action plan that people would use to manage their mental health. But it starts off in a way of saying, what keeps me well at work? What are the habits and behaviors that support me to perform my best? What might cause me to struggle? What are those unique triggers and stresses that are particular to me? And then what do I need to do to support myself? And what can my manager do to support? So it's kind of having those routine conversations proactively, but talking about what keeps me well and thinking about that positive stuff, as well as what to do if there's a challenge. So yeah, I think trying to have those conversations and embed it into business as usual.
Brilliant, perfect. And I'm afraid that that's all the time that we've kind of got for the Q&A bit, but very quickly, just to summarize there, that focus on positivity and the things that we do well are so very underrepresented in a lot of businesses. A fantastic point to finish on. And some element there of positivity as well, Cassie, there's been comments and questions that have come through that just really reflect that you've done an amazing job. So definitely check those out before this session finishes, because you've been fantastic.
Great, thanks, Peter. So just to close then, I'd like to thank you all for attending this webinar, and I'd also like to extend a massive thank you to Emma, Mamo and Dr. Karen Michell for the valuable insights today. I'm sure we'll all take something away with us. If you'd like to listen back to any of today's discussions, a copy of the recording will be available on the IOSH webinar page in the coming days. Or alternatively, if you'd like to continue the conversation regarding wellbeing or mental health, or if you'd like to keep up to date with upcoming webinars and events organised by the IOSH Future Leaders Steering Group, you can join our LinkedIn page by searching the IOSH Future Leaders Community Group. We're currently organising the Future Leaders virtual conference, which will take place on the 29th to the 31st of March this year. It's going to be a fantastic event filled with webinars, presentations, workshops, Q&A sessions, and also networking opportunities. So if you'd like to register your interest in the event, you'll be able to do so via the IOSH website. So that's all from us. Thanks again for attending, and hopefully see you at the conference.
Thanks all. Bye.
Thank you, everyone.
Bye.
Cheers. Take care.